Right now, as you watch this video, there is a sign hidden somewhere on your body. It is not painful. It does not feel unusual. Most people never notice it. But medical researchers have spent decades studying this one sign, and what they've found is extraordinary. This sign, located in your legs, can predict whether your heart is heading toward a serious cardiovascular event, sometimes up to 10 years before it happens. And the most remarkable part? You can check for it yourself right now from where you're sitting. In the next 18 minutes, I'm going to walk you through exactly what this sign is, what it tells doctors about your cardiovascular system, who is most at risk, and what you can do starting today if this sign applies to you. Stay with me until the end, because the last section may be the most important part of all. B-roll. Legs, circulation diagrams, gentle human imagery. Soft, ambient music in. Most people think of heart disease as a problem that lives in the chest. And that makes sense. The heart is there. The pain is there. The warning signs we've all been told to watch for, chest tightness, shortness of breath, arm pain, they all point upward. But cardiologists have known for many years that the earliest, quietest warning signs of cardiovascular decline often show up far from the heart. They show up in the legs. Here's why. Your cardiovascular system is one continuous network. The same arteries that carry blood to your heart also carry blood to your legs, your feet, your kidneys, and your brain. They are all connected. When that system begins to break down, when cholesterol builds up, when artery walls stiffen, when blood flow starts to slow. It doesn't always start in the heart. Often, it starts in the peripheral arteries, the ones that run down through your abdomen, your pelvis, and into your legs. And because those arteries are far from the heart, the signs appear there first. This is why vascular specialists and cardiologists now work so closely together. A problem in the leg arteries is not just a leg problem. It is a window into the health of the entire cardiovascular system. The condition we're talking about today is called peripheral artery disease, or PAD, and it is one of the most underdiagnosed, underrecognized conditions in older adults in America. Peripheral artery disease develops slowly. It begins, usually, in a person's 40s or 50s, sometimes even earlier. But it rarely causes noticeable symptoms until it has been quietly progressing for years. Here is what happens inside the body. Cholesterol particles, calcium, and inflammatory cells gradually accumulate along the inner walls of the arteries. This process is called atherosclerosis, and it does not happen overnight. It is a slow, steady narrowing. As the artery narrows, less blood can pass through. The tissues downstream, muscles, nerves, skin, begin to receive less oxygen than they need. In the heart, this narrowing eventually leads to angina, or a heart attack. In the brain, it can lead to a stroke. In the legs, it produces a set of signs and symptoms that most people either ignore or mistake for something else entirely. And here's what makes PAD such an important predictor of heart attack risk. The same disease process, the same atherosclerosis, that is narrowing the leg arteries is almost certainly narrowing the coronary arteries at the same time. The leg is giving you an early warning that your heart hasn't given yet. Research published in major cardiology journals has consistently shown that people with PAD have a dramatically elevated risk of heart attack and stroke, sometimes 2 to 4 times higher than people without it. And the earlier PAD is caught, the more time there is to intervene. So what exactly are the signs? There are several signs that may indicate reduced blood flow in the leg arteries. Some are things you feel, others are things you can see. Let me go through each one carefully. Sign 1, claudication, most classic. Calf pain or cramping during walking that stops when you rest. Feels like a deep ache or tightness that comes on after a consistent distance and relieves itself within minutes of stopping. Many people assume this is aging or arthritis. When the pattern is consistent, it deserves medical attention. Sign 2. Temperature difference. Place both hands on each foot right now. Does one feel noticeably colder? A significant, consistent temperature difference between feet can indicate one leg is receiving less blood flow. Sign 3. Skin color changes. Skin with reduced blood supply may become pale, bluish, or purplish. It may appear shiny or feel unusually tight. Redness that worsens when the leg is lowered and fades when elevated is also a notable pattern. Sign 4. Slow healing wounds. Healthy circulation allows wounds to heal. When blood flow is reduced, even a small cut or blister on the feet or lower legs can take weeks or months to close, or may not heal at all. This warrants prompt evaluation. Sign 5. Weak or absent foot pulse. A doctor can check pulse points on the top of the foot and behind the ankle. A weak or absent pulse in these locations is a clear clinical indicator of reduced arterial flow. Sign 6. Hair loss on legs, toenail changes. Hair follicles and nail beds in the lower legs require steady blood supply. When circulation drops, hair may stop growing in those areas, and toenails may grow more slowly, thicken, or become brittle. Having one of these signs does not mean you have PAD, and having PAD does not mean a heart attack is certain. But if you recognized yourself in 2 or more of those descriptions, especially if you are over 60 nung, that is a conversation worth having with your doctor. Segment Who is most at risk B-roll imagery. Personal self-insertion for viewer. Calm narration. PAD affects an estimated 8 to 12 million Americans. But because its early symptoms are so easy to dismiss or misattribute, a large number of those people don't know they have it. Smoking is, by a wide margin, the single greatest modifiable risk factor for PAD, 4 times greater likelihood. The chemicals in cigarette smoke damage artery walls directly and accelerate plaque buildup. Diabetes is the second major risk factor. High blood sugar over time damages both large and small blood vessels throughout the body. People with diabetes are particularly prone to PAD in the smaller arteries of the foot. High blood pressure and high cholesterol both accelerate the atherosclerotic process significantly when combined with other risk factors. Age is a factor. The risk of PAD rises sharply after 60 and continues to increase with each decade. Race also plays a role. African Americans have approximately twice the prevalence of PAD, a disparity linked to higher rates of diabetes, hypertension, and differences in access to early screening. Family history matters. If a parent or sibling had cardiovascular disease at a relatively young age, your own risk profile is meaningfully elevated. None of these factors alone determines your fate, but knowing your risk profile is the first step toward doing something about it. If you are concerned about the signs we've discussed today, the good news is that PAD can be detected with a very simple, non-invasive test. It is called the ankle brachial index, or ABI. A healthcare provider measures your blood pressure at your ankle and at your upper arm using a standard blood pressure cuff and a small ultrasound device. The ratio of these two measurements gives a number called the ankle brachial index. A normal ABI is between 1.0 and 1.4. A reading below 0.9 indicates peripheral artery disease. The lower the number, the more significant the narrowing. A reading below 0.4 is considered severe. This test takes approximately 15 minutes. It is painless. It requires no needles, no imaging equipment, no special preparation. And yet, it is not routinely performed in most primary care visits, which is why so many cases of PAD go undetected for years. If you have 2 or more of the risk factors we discussed, or if you recognized any of the leg signs, asking your doctor specifically for an ABI test is entirely reasonable. It is a low-cost, high-value screening tool. B-roll and avatar alternating. Hopeful, empowering tone. A diagnosis of PAD is not a verdict. It is information. and information used well is protective. The treatment of PAD has 3 goals: to relieve symptoms, to slow or reverse the progression of arterial disease, and most importantly, to reduce the risk of heart attack and stroke. Quitting smoking, if you still smoke, is the single most effective intervention. People who stop smoking have significantly slower disease progression and meaningfully better cardiovascular outcomes. A supervised walking program, even for people who experience claudication, has strong evidence behind it. Regular walking, gradually increasing in duration and distance, has been shown to improve circulation, develop alternative blood vessel pathways, and reduce symptoms significantly. A heart-healthy diet emphasizing vegetables, whole grains, lean proteins, and olive oil, limiting saturated fats and refined sugars, supports the overall cardiovascular system. On the medication side, doctors often prescribe antiplatelet agents such as aspirin or clopidogrel to reduce clot risk. Statins are frequently recommended to stabilize arterial plaque. Blood pressure and diabetes medications are adjusted as needed. In more advanced cases, procedures such as angioplasty or stenting may be considered. Bypass surgery is reserved for severe cases. The important takeaway is this: PAD that is caught early or true before it causes a heart attack or stroke is highly manageable. The window between early diagnosis and serious cardiovascular event is a window of opportunity, and many people who use that window well go on to live active, healthy lives for many years. Avatar on screen. Warm, direct, calm. Soft music rises gently. We started this video with a simple idea that a sign hidden in your legs can tell you something important about your heart before your heart tells you itself. That idea is not a theory. It is well-supported medical science studied for decades by vascular surgeons, cardiologists, and epidemiologists around the world. The leg is a messenger, and most of us have never been taught to listen to it. What I hope you take from today is this: if you are over 60, take 2 minutes right now to think through what we discussed. Check the temperature of your feet. Think about whether you've noticed cramping on walks that goes away with rest. Look at the skin and hair on your lower legs. If something stands out, write it down before you forget. Bring that note to your next doctor's appointment. Ask specifically about the ankle brachial index test. You are not being alarmist. You are being proactive. And there is a significant difference between the two. Early awareness is the most powerful cardiovascular tool most people never use. Thank you for spending this time learning something that may genuinely matter for your health. If this video was useful to you, consider sharing it with someone you care about. The people around you have legs too, and they deserve to know what those legs might be telling them. Take care of yourself.